If you are over 60, one prescription you trust could be quietly putting your heart under stress every single day, and most people never realize it until something breaks. For most older adults in the U.S., medications feel like safety. If a doctor prescribed it, it must be protecting you, not harming you. That belief is exactly why medication-related heart damage can stay invisible for years. Cardiologists and cardiac surgeons are not seeing dramatic poisonings. They are seeing something much more unsettling. Hearts that look older than the patient. Heart muscle that is weaker than expected. Electrical systems that suddenly become unstable. And when they trace the history back, the same medication categories appear again and again. What makes this especially dangerous for seniors is that symptoms rarely feel dramatic at first. It is not a crushing chest pain. It is subtle fatigue, a little more shortness of breath climbing stairs, lightheadedness when standing, a strange flutter at night, sleep that feels less refreshing, anxiety that appears without a clear reason. Many people blame age or stress, but the body may be responding to a chemical environment that slowly changed over time. This is where fear starts. Once someone begins to worry about their heart, anxiety itself raises blood pressure, worsens palpitations, and tightens the chest. A loop forms. This video is about breaking that loop with understanding, not panic. Proton pump inhibitors are among the most commonly used drugs in America for acid reflux and heartburn. When used short-term, they can be extremely helpful. The concern is long-term daily use, especially in older adults. Some research suggests that chronic PPI use may interfere with nitric oxide production in blood vessel lining cells. Nitric oxide is critical for keeping arteries relaxed and flexible. It helps prevent excessive clotting and inflammation. When nitric oxide availability drops, arteries can stiffen, blood pressure can creep upward, and the heart must pump against more resistance. For a younger person, this change may not matter much. For someone over 60 whose vessels are already less elastic, it can quietly increase cardiovascular strain. This does not mean PPIs are evil. It means they should not be treated as automatic lifelong medications without review. If you have been on one for years, ask your doctor if you still need it at the same dose. Ask whether lifestyle adjustments, timing changes, or alternative acid-reducing options might reduce risk while still controlling symptoms. Antibiotics save lives, and no one should be afraid to take them when needed. But some classes, particularly fluoroquinolones, carry special warnings that matter more in older adults. These drugs have been linked to rare but serious vascular problems and heart rhythm disturbances, especially in people with existing vascular disease, high blood pressure, or multiple medications. The key here is not fear, it is context. Many seniors hear the word aneurysm and panic. The reality is that risk is not equal for everyone. The practical step is simple and reasonable. If you are prescribed one of these antibiotics, ask whether a safer alternative would be effective for your specific infection. For uncomplicated infections, older antibiotics often work just as well. Also, make sure your doctor knows about any history of palpitations, fainting, or heart rhythm issues. This is not confrontation, it is collaboration. Non-steroidal anti-inflammatory drugs like ibuprofen and naproxen are everywhere in American homes. They reduce pain and inflammation effectively, which is why many older adults rely on them daily for arthritis or chronic aches. The problem is that regular NSAID use can raise blood pressure, increase fluid retention, and shift the body toward clot formation. These effects place extra workload on the heart. What catches seniors off guard is that risk does not always require years of use. In some people, cardiovascular risk begins rising within days or weeks. Swollen ankles, sudden weight gain, higher blood pressure readings, or worsening shortness of breath are warning signs many people miss. Pain relief should never be automatic. If you are using NSAIDs often, talk with your doctor about safer long-term strategies, topical options, physical therapy, and whether other pain management approaches could reduce heart strain. Diabetes itself is a major driver of heart disease. Over 65 report sleep problems. When exhaustion builds, prescription sleep aids can feel like salvation. But some sleep medications suppress breathing and worsen sleep apnea, a condition that already stresses the heart by lowering oxygen levels during sleep. Low nighttime oxygen is one of the strongest silent drivers of high blood pressure, arrhythmias, and heart failure. Sleep medications also increase fall risk. For seniors with heart disease, a fall and hospitalization can trigger serious cardiac events. This is why non-drug approaches like cognitive behavioral therapy for insomnia and strict sleep routines are often safer and more effective long-term. If sleep is poor, the real goal is not unconsciousness. It is restorative sleep that protects the heart. Antipsychotic drugs are sometimes prescribed in older adults for agitation, behavioral symptoms, or dementia-related issues. These medications carry strong warnings because they can increase sudden cardiac death risk through rhythm disturbances, blood pressure instability, and metabolic changes. What many families do not realize is that agitation often has a cause. Pain, infection, dehydration, medication interactions, and poor sleep can all trigger behavioral changes. Addressing these factors first can sometimes eliminate the need for powerful drugs. When medication is necessary, it should be used at the lowest dose for the shortest possible time with close monitoring. This is the category many heart specialists worry about the most in older adults. Opioids suppress breathing, especially during sleep, lowering oxygen levels and placing enormous strain on the heart. Over time, they disrupt the autonomic nervous system that controls heart rate and blood pressure. They also increase inflammation and interact dangerously with other common medications. The danger is highest when opioids are combined with sleep medications or anxiety drugs. Many seniors do not realize how powerful this combination can be. The path forward is not abrupt stopping. It is careful tapering when possible, and a shift toward multimodal pain management that treats pain without quietly harming the heart. Most medication-related heart damage in older adults does not happen because of a mistake. It happens because of time and silence. A drug is often started during a crisis, pain, infection, surgery, or sleeplessness. At that moment, the benefit is obvious. Older adults know something feels wrong, but do not know how to bring it up. The goal is not confrontation. The goal is clarity. Instead of saying, "This medication is hurting me," say, "I've been on this medication for a long time, and I want to make sure it's still the safest option for my heart." That single sentence changes everything. It invites collaboration instead of defensiveness. Bring a written list of all medications and supplements. Ask which ones affect blood pressure, heart rhythm, breathing, or fluid balance. Ask whether any combinations increase risk. Ask if there is a plan to periodically reassess long-term medications. Good clinicians respect these questions. If the answer is, the benefit still outweighs the risk, that is valuable reassurance. If the answer is, we could consider adjusting this, you just reduced future risk without panic. Silence protects nothing. Informed conversation protects lives. The most important message is not that medications are dangerous. The message is that bodies change with age, and treatment plans must change with them. What was safe at 55 may not be ideal at 70. What helped during a crisis may become a burden when used indefinitely. Your heart is not failing silently. It is responding to conditions. If you are over 60, your power move is simple. Awareness, not fear. Review, not rebellion. Ask questions, not accusations. The goal is not to stop living comfortably. The goal is to protect your heart while you do. Because the most dangerous medication is rarely the newest one. It is the one you stopped thinking about years ago. So the real threat is not one bad pill. It is taking the same medication for years without a second look. If you are over 60, your most powerful move is not fear. It is awareness. Make a list of your medications and ask one question at your next visit. Is this still the safest option for my heart today? Because the most dangerous drug is often the one you stopped thinking about.